Africa is rising. 15 years after the Abuja declarations on rolling back malaria and on ending AIDS and tuberculosis, African leadership has made unprecedented strides in responding to the three biggest health epidemics on the continent. African countries have implemented the AU roadmap, which calls for shared responsibility and global solidarity to end AIDS, TB, and malaria. The roadmap has provided an African-led pathway to address these diseases and has helped pioneer new models of ownership, accountability, and partnerships from community to global levels. African countries are closer to reaching the agreed Abuja target of allocating 15% of their total government expenditure to health. The impact of African leadership's commitment in the case of HIV has been significant. In less than a decade, access to HIV treatment in Africa has increased more than 100-fold. Approximately 10 million people are now on treatment. New HIV infections in Africa south of the Sahara declined by 33% and AIDS-related deaths by 39%. Similarly, increased political commitment and expanded funding have helped to reduce malaria incidence by 31% in Africa. As a result, an estimated 337 million malaria cases and 3 million deaths were averted in the African region. While malaria mortality rates have declined by 54% overall and by 58% among children. Additionally, the picture of the TB epidemic is shifting positively. Africa's TB treatment success rate reached 86% in 2013, and in the same year, the case detection rate had slightly improved at 52%. Africa outpaced other regions in determining the HIV status of all people with TB. Despite historic gains, these epidemics are far from over. AIDS remains a leading cause of death in Africa, killing 1.1 million people on the continent in 2013, with an estimated 1.5 million new infections. An African child still dies almost every minute from malaria, and to combat this, approximately $1 billion is required. The TB response will need to reach about 1.3 million people in Africa. While significant progress has been made in domestic financing for health, with global domestic investment doubling spending on AIDS, TB, and malaria between 2006 and 2011, a huge gap still remains. The fact remains that health funding in most African countries is below what is required to achieve a functional, basic health system and to end the scourge of these diseases. This funding crisis calls for accelerated innovative domestic financing, like shifting existing alcohol or airline levy budgets towards spending on these diseases. New initiatives to diversify funding sources, like boosting private sector commitments. Increased global partnership and solidarity to ensure these needs are met. Fully funding the global fund to fight AIDS, TB, and malaria must remain a key global priority in mounting an effective response to these three diseases. We call upon the international community to increase their resources. As Africa finalizes its long-term development framework, Agenda 2063, we must tap into our huge economic growth to finance health. We must continue to push forward, collaborate, and innovate to defeat the continent's biggest health issues. Our collective progress is significant, but we are not done yet. Together, let us ensure that Africa continues to rise and end AIDS, TB, and malaria by 2030.